Hello everyone, welcome to Sharmit. In this session, we are going to talk about another very interesting topic related to medical coding anatomy, where we will be mainly talking about the pathological conditions of ear. Okay, so here we will discuss in detail what are the pathological condition for the ear, how actually it works, and the overall scenario related to all the pathological conditions of ear. But before we proceed further with this session, I would like to recommend you to please go and check out the previously released session first, because they all are in proper sequence and sync. So if you follow it sequentially, then it would be much more easier for you to understand the ongoing topic, because for timing we are just mainly focusing on all the conditions related to pathological condition related to ear. But prior to that, you should know what is the anatomy of ear and all the other basic things. And for that, you can also refer the Sharmit digital course book, which is freely available in the description box. There you will find thousands of sessions available in both Hindi as well as English language. So without any language barrier, you can easily consume the content. And in case if you have any queries or question related to that, then feel free to reach out to me through comment section. I would be more than happy to answer all your questions there. Okay. Alright, so let's see what are the conditions there. So first thing is acoustic neuroma. Acoustic neuroma, which is a benign, a non-cancerous tumor, and this non-cancerous tumor is something that grows on acoustic or vestibulocochlear nerve, which is the 8th cranial nerve responsible for hearing and balance. Okay, so this nerve is mainly responsible for hearing and balance. Okay, second thing is cholesteatoma. Cholesteatoma is nothing but an abnormal collection of skin cell and cholesterol that forms a sac-like growth within the middle ear, out of skin cells and cholesterol, which later can damage the nearby structure if left untreated. Okay, so if this sac-like growth is not treated properly, then it will cause or damage the nearby structure definitely. Okay, third thing is deafness. Deafness is a condition which is referred to a partial or complete loss of ability to hear. Okay, so if due to any reason, if partial or complete loss of hearing is occurred in the patient, then that condition can be defined with the term deafness. Okay, then we have Meniere Disease, which is a disorder of labyrinth inner ear caused by elevated pressure of the endolymph fluid. Now I'm assuming that you already know the meaning of this endolymph fluid, because this thing we have discussed, right? We talked about two fluids when we were talking about the ear anatomy, right? So this is from there. So the condition is, it is a disorder of labyrinth caused by the elevated pressure of endolymph fluid, affecting both cochlea and the semicircular canals, and often leading to vertigo, hearing loss, and tinnitus. Okay, so it could cause these three things. Vertigo, we'll discuss what is vertigo, hearing loss, and tinnitus. Okay, now let's see what is vertigo actually, because I'm sure like you might have heard about this term a lot, right? Vertigo. So vertigo is nothing but a sensation of irregular or whirling motion, as either on self or on the surrounding environment is spinning, even when there is no actual movement. So sometimes like patient feel that there is a spinning, the environment is spinning around him, right? This is because of that vertigo condition. Okay, then we have osteosclerosis, which is an abnormal hardening of the bony tissue within the middle ear, which can restrict the movement of ossicles and lead to the hearing loss. So why these occipital movement is blocked? Because of these hardening of the bony tissue within the middle ear. Okay, so sometimes if someone gave you the task where these conditions are specified like osteosclerosis or vertigo, so you should know about at least these terms. Okay, that's why we are going through it. Then we have tinnitus. Tinnitus is a condition referred to the perception of noises such as ringing, buzzing, whistling, or booming in the ears without an external sound source. Yes, this is a condition where patient will feel that a bell is ringing near their ear, right, or whistling, booming. So these all things are because of the condition tinnitus. Okay, this is tinnitus. Next thing is otitis media, which is nothing but an inflammation of the middle ear, often caused by the infection. Okay, so because of the infection, if middle ear is inflamed, then this condition is defined as otitis media, and it is a common condition, especially in children. Okay, so I think this part is clear to everyone. What are the pathological conditions of ear? Now we will talk about the common abbreviation related to ear, because this is also very important for us to understand the things. Okay, so let's go one by one and see what all abbreviations are there. The first thing is AOM, which stands for acute otitis media, or sudden infection or inflammation of the middle ear. Okay, so if due to any condition, if sudden infection or inflammation of the middle ear occur, then this condition is known as AOM. Next is EENT, which stands for eyes, ear, nose and throat, similar to the HENT, but without reference to the head. Third thing is ENG, which stands for electron stemography. So ENG stands for electron stemography, which is a test used to evaluate eye movements and diagnose balance disorders. Okay. Then we have next term, which is ETD, which stands for eustachian tube dysfunction, a condition where the eustachian tube fails to properly equalize ear pressure. Okay. After that we have SOM, which stands for serous otitis media, which is nothing but a buildup of fluid in the middle ear without active infection. Okay, so without any active infection, if it occurs, then it is considered as serous otitis media. Okay, I think we are good with this thing. We talked about pathological conditions of ear and also the common abbreviation related to ear. Now I'll tell you the quick summary. Okay, because we have covered both type of special sense, ear and eye. Okay, so let's quickly review it. Okay, so just revise it. So if we talk about the eye pathway, then in that case, like light passes through the cornea, then the pupil, then the lens, then the vitreous humor, then reaches to the retina, where rods and cones detect it, and finally travel through the optic nerve, optic chiasm and thalamus, before being interpreted in occipital lobe of the brain. Clear? So this is the pathway for eye. Similarly, we talked about the ear pathway, where sound passes through the pinna, then ear canal, then strikes the eardrum, then moves through the malleus, incus and stapes, then passes through the oval window into the cochlea, where the organ of corti converts into nerve signals, and finally travels along the auditory nerve to a cerebral cortex. Clear? So I think this part is clear. Now we will talk about some phrases that we should know, because we have already covered these phrases. The first is white of the eye, which refers to the sclera, the tough outer coating of the eyeball. Second phrase is blind spot, refers to optic disc, the point where the optic nerve exits the eye and where there are no light sensing cells. Third is true organ of hearing, which refers to the organ of corti located inside the cochlea, where sound vibrations are actually converted into nerve impulses. Next we have is the phrase hammer, anvil and stirrup, refers to the three tiny bones of middle ear, known respectively as the malleus, incus and stapes. Then we have the term farsightedness, which refers to the hyperopia, while the term nearsightedness refers to myopia. Okay. Next phrase is the ringing of the ears, ringing in the ears, which is referred to the tinnitus condition. And I'm sure like this thing you already know, because I'm sure this is a popular condition of ear. and the spinning sensation is also known as vertigo. So these are the all notes related to the pathological conditions of ear and the quick summary. Now there is one question for all of you, and today's question is, what is cataract? You just need to think about this topic, like what is cataract, and just answer the question in a short way in the comment section, so that others can take a reference from the knowledge you are sharing, from the expertise you are sharing. Okay, and also when you are sharing the comments in frequent way, in a repetitive way, it gives me the notification and it will tell me that you guys are learning from these sessions, and on the basis of that only I will publish more sessions to this playlist. Yeah, so yeah, that's all for today. See you in the next session with new topics. So thank you for watching Tech Sharmit.